Welcome back to Natural Recovery Greens channel. I wanted to today introduce you to the real brains behind the operation, Dr. Adrienne Olander. So today what we're going to talk about a little bit is, number one, Adrienne's experience. Number two, cannabidiol and its effects on the human body, side effects. We're also going to talk about opioids and kind of what constant use over the years can do to your organs. So we wanted to take a little bit of time going over the benefits of natural methods of pain relief, nutrition, and just overall wellness, and most importantly, to introduce Adrienne. So first of all, Adrienne, why don't you tell everyone out there kind of what you do for your job?
I'm a pharmacist in nursing homes. I do long-term care consulting. I review the medications every month and check for interactions between their medications. I look at their lab reports to make sure that the appropriate monitoring is being done, and just always check to make sure that everyone is taking the lowest dose of medications and the least amount of medications as possible to treat their condition.
Now, when you're reviewing charts and going through all your patients' records, I mean, are there more and more medications that are constantly prescribed, new medications out on the market? Is that really what your job is, to make sure that these new medications coming in are not going to negatively interact with something else that the patient could have been taking for an extended period of time?
Yeah, checking for those interactions and also making sure that a new medication that's added isn't being prescribed to treat a side effect of another medication that they're taking, and just try to minimize medication usage in general and limit it to only strictly what is absolutely necessary to treat their diseases.
In the news, there's been a lot of talk about opioids and dependence and overprescription. Are you seeing that in the long-term care pharmacy?
Yeah, the long-term care patients are also taking heavy doses of narcotic prescriptions and opioids, and the not only is the government cracking down, the Medicare and insurance companies are reducing coverage of that and also trying to regulate. Even as of January 1st, there is a new regulation about minimizing the prescription of those, and only 7 days at a time for new patients that are opioid naive. And they're just, it's really gotten their attention because opioid use has actually quadrupled from 1999 to 2016. So obviously there is an epidemic here in the US, and they're really trying to crack down on that.
So opioids in general, how bad are they? If, I guess, opioids in general, or the abuse of opioids, how damaging is that to your system, to your liver, to your organs?
It can be damaging to your body. The biggest thing is the addiction properties of them, which, you know, when they first came out, that wasn't advertised by the pharmaceutical companies, and as they became prescribed more and more, it's now come to light how terribly addicting these are.
Now, because of that, is your company or other pharmacists, are they starting to look at other natural ways to replace some of these opioids, or what are some of the methods they're looking at?
Yeah, there are a lot of non-pharmaceutical interventions that they do. They could do massage therapy, music therapy. Some of the nursing homes have specialized programs for that, aromatherapy. I have not seen CBD yet in the nursing home setting, but I know it's gaining a lot of popularity and more media attention, and that it's just a matter of education and...
Yeah. But CBD is in pharmaceutical companies. Some pharmaceutical companies have come out with drugs that have either CBD in them or synthetic cannabidiol. Do you know?
The synthetic form has been out there for a while, Marinol with to treat nausea and vomiting for cancer patients, and also increase appetite. The synthetic version has been out, but just recently, just last year, was the first actual natural CBD prescription product that was approved by the FDA, called Epidiolex, to treat pediatric seizures.
And do you know what kind of doses of, I guess, CBD is in each of those prescriptions?
The Epidiolex is in 100 milligram per ml vial or dropper form. So, and the recommended dose is 10 milligrams per kilogram. So, for a child that is, say, 60 pounds, the dose would be like 300 milligrams a day of CBD. So, very high dose, or higher doses than what is in our product.
Have you seen, or have any studies come out about any, well, let me take that back. Because you look at side effects of drugs interacting negatively, have you also looked at things people should be aware of if they're going to look at taking CBD oil or just CBD in general, if they are on other medications, just something they should be cognizant of, or they should ask their doctor?
Yeah, CBD is metabolized in the liver, so there are potential drug interactions with other medications that are also metabolized in the liver. So I recommend using a website, drugs.com, and there's an interaction checker. You can type in your complete list of medications there and actually type in Epidiolex, because that is just pure CBD. So if you type in the Epidiolex, that'll give you the CBD component, and then the rest of your medications to check for any interactions that are there. And as far as food interactions, grapefruit juice increases the level of CBD in your body.
Why is that? It just doesn't metabolize well, or?
The grapefruit juice is a inducer of, or actually I think it's an inhibitor.
Well, it just slows it down, right?
It slows, grapefruit juice slows down the metabolism of the CBD, so it stays in your system longer and builds up.
Okay. Are there side effects that have been attributed to CBD? Or is there a dependence? Is there worries about, hey, can someone become addicted to CBD? I mean, it's non-psychoactive. I mean, we know that, but could it become like an opioid where people crave it?
Right. The literature suggests that it is not addictive in that way, as far as hitting the addictive receptors in your brain. But just like anything, humans can become addicted to anything: exercise, food, anything else. So, but no, it is not. It does not hit the receptors, the addictive components like opioids.
And going off of that, are there any side effects? Can you take too much CBD? I mean, are there some things that people may feel after taking CBD if it doesn't, I guess, work with the body's physiology?
CBD has a biphasic metabolism, meaning if you get too much of it, it actually has the opposite effect of what you want to do. So, of what you want.
So it cancels it out.
Feel.
So that's important.
So too much
will just wipe it out, and you won't get any effect. So proper dosing and really understanding what, I guess, amount of milligrams for the results you want is important. And we're going to be going over that in the next video. So stay tuned for that one. So, what about, are there any other ways that you can help absorb CBD or boost the effects of CBD within your body?
Actually, taking CBD with food on a full stomach enhances the bioavailability of CBD. So it'll stay in your system longer, and you will absorb more, get more of an effect from it if you take it with food.
All right, so talking more about, it being on a full stomach, are there any foods that, we should worry about taking it with, or, are there some foods that negate some of the effects of CBD that you're looking for that people should be cognizant of?
Actually, some studies have shown the reduced absorption of CBD when it's taken with high sugar foods and high fatty content foods. So, the cleaner your diet and the less sugar that you consume with it, I think you'll get a better result.
Great. All right, everybody. I think that's all we got for today. So please leave some comments, questions. We'll be more than happy to get back to you, or in our next series with Dr. Adrienne here, we'll be sure to touch those subjects. But thank you for tuning in. Check out Natural Recovery Greens at naturalrecoverygreens.com, and we've been getting a lot of great feedback, helping a lot of people out there. So hoping you can join in as well. Take care.